Hello and welcome to AnesthesiaTOOLS Lightning Reviews, the podcast where we explore evolving trends and practices in anesthesiology. Today, we're discussing a rapidly growing and vital area of our specialty, non-operating room anesthesia, or NORA.
That's right. NORA is becoming a bigger part of our day-to-day work. Whether it's endoscopy, interventional radiology, or cardiac cath labs, more and more procedures are happening outside the traditional operating room, and they all need safe, effective anesthesia care. So, what do we mean when we say non-operating room anesthesia? Simply put, NORA refers to the administration of anesthesia or sedation outside the conventional operating room. We're talking about locations like the endoscopy suite, cardiac cath lab, interventional radiology, CT or MRI rooms, and even psychiatric settings for procedures like electroconvulsive therapy or ECT.
Exactly. These are procedures that may not be surgical, but they can still be painful, uncomfortable, or anxiety-provoking. And that's where we step in. Our role is to provide the same level of safety, vigilance, and care that we do inside the OR, even though the environment is often very different.
Let's talk about those environments for a moment. Each NORA site has its own setup and challenges. For instance, in the MRI suite, we're working around strong magnetic fields, which means specialized MRI-compatible monitors and equipment are needed.
Right, and in the interventional radiology suite, the anesthesia provider might be positioned away from the patient because of the imaging equipment, sometimes with limited access. So we need to plan airway management, monitoring, and emergency responses before the procedure begins.
And let's not forget, the further we are from the main OR, the more we have to rely on our own preparedness. Equipment, emergency drugs, and even backup staff may not be immediately available.
NORA isn't just about logistics. It's also about patient factors. Patients who come for these procedures are often older, sicker, and more medically complex. Many have multiple comorbidities that can increase the risk of adverse events, especially respiratory events.
That's a really important point. Respiratory compromise remains one of the most common and preventable complications in NORA. Ensuring proper monitoring, airway readiness, and a clear plan for escalation are essential to maintain patient safety.
And speaking of monitoring, even though we're outside the OR, the same ASA standards apply. Continuous ECG, pulse oximetry, capnography, and blood pressure monitoring should be the baseline for all cases.
Let's move to the management aspect. NORA requires dedicated protocols tailored to each location, from pre-procedure evaluation and consent to intraoperative anesthesia plans and post-procedure recovery.
Remember, teamwork is crucial. We need effective communication with the proceduralists, nurses, and technicians who may not be used to working with anesthesia regularly. Implementing a customized WHO surgical safety checklist for a given location of NORA would be highly useful. It is also important to educate the non-anesthesia colleagues regarding the interventions for patient safety. A clear understanding of the patient's status and procedure timeline can prevent many mishaps.
Exactly. And patient selection plays a big role too. Not every patient is an ideal candidate for sedation in a remote suite. Some may need the backup and resources of the main operating room. A well-thought-out pre-anesthetic evaluation ensures we're making those calls safely.
As more procedures shift outside the OR, NORA will continue to grow, and so will our responsibilities as anesthesiologists. The goal remains the same: to provide safe, high-quality anesthesia care wherever the patient is.
Absolutely. Whether we're in a high-tech cath lab or a busy endoscopy unit, the principles don't change: vigilance, preparedness, and communication.
That brings us to the end of today's episode on non-operating room anesthesia. Remember, every environment we work in deserves the same safety standards as the OR.
Thanks for listening. If you enjoyed this episode, don't forget to share it with your colleagues and postgrads. Join us next time for another deep dive into the evolving world of anesthesiology.